time. Learn. Well, good afternoon, all of you. I am Jan Premalal. In my group has Professor Siri Hettige and others. Then I would like to say Japan, we compare Japan and Sri Lanka. Japan has a systematic integrated program for elders, but Sri Lanka not yet. Otherwise, Japan has full systematic and there are parallel officers. In Sri Lanka, there are systematic program. Year 2009, Parliament brought Act Elders Care. Unfortunately, they established National Elders Housing and under National Secretariat. And National Secretariat conducted elders promotion officers, but there are not enough. And government began village level social care program, village level social care society, and we also joined with MOH, medical officers and other relevant organizations and institutes. And fourth one, we began pre-retirement program for elders. But after some time, we have to stop it because so many retirement people don't like to participate. We discussed about it. Then after retirement, what are you going to do? Then in Sri Lanka, that there are two care systems. One is pension system, otherwise EPF and ETF. Employee trust fund and employee provident fund. Then more people, more elders after retirement, they build a house or they married their children. After that, they lost, and more people don't have income. Then they became innocent. And I am also retired social service officer. Then we did it. Then we have pension, but EPF and ETF people, they don't have income. They automatically will innocent. But Japanese has a fully social care system, social security system. And recently my friends went to Japan. They said that local government institution, they conducting social care program. Then one of the speakers said that dementia, actually Japanese has dementia cafe for elders. And they come and they very joyful life. And in Sri Lanka also, there are so many dementia people. Unfortunately, in Sri Lanka, more families, they don't know how to understand their behavior because they can't memorize present thing, but they know their history, their childhood, their school time, they explain. But father, did you take a dinner? No. But that's a problem because some daughter-in-laws, they are very sorry because she given his or her dinner or lunch, but children ask, how about your lunch, dinner? No, like that. Then we have to aware because Japanese has fully aware program for the family, and people know what is the dementia, and they look after their parents and elders. But in Sri Lanka, more dementia patients, they are very isolated because because we want to fully aware program in Sri Lanka. Otherwise, Japanese has fully mission and vision about elders. But we have, my country have that vision and mission for elders according to year 2000 number 9 Elders Care System Parliament Act. But how can we implement it? Because we have to, there are so many relevant officers in Division Secretariat. Division Secretariat is the most important institute of Sri Lanka. We all conducting government policies, but there are no so many social workers. Without social workers, then how can we conduct our program? Then actually I am very proud because I am come from country yard. I am a village one. Then our village has had the extended family. That was our family system first one because fathers, mothers and fathers and their unmarried sisters and brothers, and there are so many disabled people. But problem is our extended family became a nuclear family because nuclear family they situated or they live at urban area, that 10 perches. Then how can they look after their elders? That's a problem. That some people migrant and some systematic things all collapse, and we don't know how to follow it. And we want to care system. Our disability people we conducting community-based rehabilitation program. But in Sri Lanka, we have to implement for the community-based rehabilitation law, community-based work for the elders and others. Otherwise, I think this is my personal idea. We want to at our school curriculum for the about the elders. Then how we can look after our elders. Japanese also consider about health education and care system. But in Sri Lanka also there are so many health care. Division wise we have MOH, medical officers of village level. But we don't have proper training officers. We are the relevant institute, behalf of the relevant institute, but they don't have training about social work, how to care elders, how to care children. There are so many officers, but unfortunately, some people after their university education they join with government, but they don't have training. In my career, in early 1993, we have to care system and discussion with in-service program. In-service program is very, very essential for that newcomers for the government. But in Sri Lanka now, there is no in-service program. If we have in-service program, we share our experience. But in Sri Lanka, there is no some system. They don't have in-service program. If in-service program if in-choice program have, then we can do more work. I know that MOH officers of MOH office, they have midwife, PHI, they meet once a month and they discuss their area problem. But I think every and each service we have to in-service. In my service, social services, we have in-service early. And there are so many training programs. But now, if some more people, they don't have training program. Early, our Sri Lanka School of Social Work, they gave training program to each and every individualized people. But now, School of Social Work and NIS National Institute of Social Development, they all depend on money. But more people don't come. They follow the diploma courses and other courses, but we have to pay. More officers, they don't have money, follow the course. Then I propose, yes, the time is over, but we have to discuss this matter. Then actually, sir, excuse me, but we have to discuss this matter, then how we can explore our officers' mind with social work. Social work is a best practice, but now there are so many officers, they don't have social work practice background. Then we followed case work, community operation work, human service delivery and social development project. Yes.
We don't discuss these things in our workplace. See the paper.
Yeah, I know. This is a paper, but we have to say this is my platform. Without this platform, then how I say this one? Yes, I stop. Thank you very much. Our people, they criticize. I know. We have to time management, but we were waiting our time. Our time was very late. And thank you very much. And we will meet again and discuss this matter. Thank you.